Welcome back, everyone, to Meditations by Gregory T. Obert, bringing you the best new guided meditations and mental health discussions every week. I'm your host, Dr. Gregory T. Obert, clinical psychologist. Thank you so much for joining me today. And this week's episode is going to be another discussion on mental health and continuing my series of just an overview of what different types of mental health conditions are. We're going to be talking about anxiety today. Yes, that wonderful, wonderful emotion that we all feel that drives us all bonkers, yet also one of those things that helps us stay alive, helps us stay motivated. So there's useful parts about anxiety and not so useful parts about anxiety, but we're going to dive into it. Listen, before we get started, just two quick plugs. First, if you like what I do here, please leave a 5-star rating and review wherever you're listening to this because it really helps the show grow. And second, if you like what you hear here, please do check out my private practice, Royal Oasis Psychotherapy Institute, where you can get elite and discreet psychotherapy. Link to that is in the description below. Now, picture this. You've been tasked to come up with this big presentation while you're at work. This presentation is going to be given in front of not only your colleagues and your peers, but also in front of the higher ups, those in the C-suite, those who have been told you know what you're doing, and you're going to brief them on this issue happening at the company and then the solutions. As I say that to you, I wonder how anxious you might be feeling right now, how worried, how nervous. Maybe you're feeling a little bit overwhelmed before you've even sat down to think about what even goes into this presentation. And here's the thing. This is completely normal. It would be a little strange if you felt nothing when given a task like that. I think I'd be worried about you for maybe a different reason if you felt no anxiety about a task like that. Here's the reality. Anxiety affects, specifically anxiety disorders, affect over 260 million people worldwide. And these make anxiety disorders one of the most common mental health issues. In fact, as I mentioned in my depression guide a few weeks back, anxiety and depression are often holding hands. It's like they're dating. They tend to go hand in hand with each other. However, just because someone is feeling anxious doesn't mean that they automatically feel depressed at the same time. So then if someone is just dealing with anxiety, what's that all about and how do we work through it? What can you expect to do if you are going to go into some kind of psychotherapy for it? Well, that's what I intend to talk about with you today. I want to talk a little bit about what anxiety is, how it develops, some theories behind it from a psychological perspective, and various treatments to help you work through those anxious feelings. Now, the treatments we're specifically going to go over are CBT, cognitive behavioral therapy, DBT, dialectical behavior therapy, and client-centered therapy, because those are my specialties. Now, here's what I would like to hear from you. What's your biggest anxiety trigger? I'd love to hear from you. Listen, I have a Twitter account. It is in the description below. Dr. GT Obert. Would love to hear from you on there what your biggest anxiety trigger is. Because, a lot of times we tend to think these things are just us. We're the ones that are dealing with it ourselves, but in actuality, there are other people out there dealing with the same thing. So I'd love to have a discussion around that. So consider sending that to me over on Twitter/X now. All right, so I keep using the term anxiety, but what do I mean when I say anxiety? So specifically, I view anxiety as a future-oriented mood state involving excessive fear or worry that's out of proportion to the actual threat. And this often manifests in physical ways like a rapid heartbeat or sweating, emotional ways like dread, and behavioral ways like avoidance. Now, keep this in mind because I want to make sure no one here is thinking that they're crazy for feeling some kind of anxiety. Notice how I said it's excessive fear or worry, and it's also out of proportion to the actual threat. So like I said in my opening, if you had anxiety, some moderate anxiety around the task at work, that would make sense. And that doesn't necessarily mean you have an anxiety disorder. If all of a sudden, wherever you're sitting, I hope this doesn't happen while you're listening to this, there's a giant grizzly bear that walks in, you'd probably be feeling very anxious, 10 out of 10 to put it mildly. That is perfectly normal. You don't have an anxiety disorder. I mean, I guess you could on top of that, but with that specific scenario, you don't have an anxiety disorder because of course you'd be afraid for your life when a giant grizzly bear walks in. It would also make sense for you to have some anxiety as you get ready for a test. Say you're in school right now, or if you can think back to when you were in school, maybe a spelling test, maybe a math test. Of course you might have some pre-exam jitters, and that's normal. That's okay. It's very different from someone who's dealing with an anxiety disorder. So think about that same person taking the test. They just become paralyzed. They're just unable to even think clearly, to study properly, because the worry and the fear is just out of proportion to the actual threat. Right, worst case scenario, you take the test, you don't do so well, okay, you move on. Maybe you got to study a little bit harder for the next one. But now if you have someone who is experiencing those pre-exam jitters at an 8, a 9, a 10 out of 10, that threat, that fear, that worry is out of proportion to the actual threat. And that's what people who have anxiety disorders deal with. Some of those more common ones include generalized anxiety disorder. So this is worrying a lot about a lot of different things in your life versus more like a specific phobia, a fear of one particular thing, or even social anxiety disorder, right? Where I'm not really afraid of things in my life except when it comes to social situations or some kind of performance-based task, like presenting in front of my company. I'm fine everywhere else, so it's not really a generalized anxiety, but it's more of a specific type of anxiety. And then, of course, another common anxiety disorder would be panic disorder, which is the presence of panic attacks and being afraid that those panic attacks are just going to keep coming back again and again and again. And you may have heard of the term panic attacks, just to kind of clarify what that is. They used to be called anxiety attacks. Well, I don't know if they used to be, but certainly kind of in common language, I hear that a lot. Oh, it's an anxiety attack. Well, in the business, we tend to call them panic attacks. And this is where a sudden, intense fear just spikes in you within minutes. Think about your heart rate increasing. Think about your temperature shooting up. Think about trouble breathing. As well as chronic worry that these panic attacks are going to keep coming up. Typically, people that have panic attacks describe them as horrific. They say it feels like they're having a heart attack. They're not. Their heart's fine, yet they're just overwhelmed by this sudden spike in anxiety. Now think about someone that has been dealing with this for a week. Not just panic attacks, but even some intense anxiety, even moderate anxiety at times where it just doesn't really fit, right? It's leaning more so into that anxiety disorder territory. Imagine someone dealing with that for a week. Now imagine a month, and now 6 months, and now even a year. Think back, as I record this episode, it is July 20th, 2025. Think back to July 20th, 2024, and someone first starts experiencing this type of anxiety. Imagine what their life might look like over the course of the next 12 months. Anxiety is going to impact so much. It's going to impact our daily lives, our daily functioning, how we connect with others, including our physical health. I mean, things like sleep. Some people may start to experience heart issues if they have that chronic, excessive anxiety over a long period of time. Now you may be thinking, yeah, Greg, that does sound not so great, and maybe even that sounds a little bit like me. So how do I know if I'm dealing with an anxiety disorder, potentially? What are some signs that that might be coming up for me? Well, one of the things that you are likely to have encountered if you have sought help for anxiety in the past, or even if you've sought help for other mental health conditions, you've probably come across a measure called the GAD-7. It's called the Generalized Anxiety Disorder 7. And it's a measure that just gives people a quick, providers really, a quick look into maybe we're dealing with some anxiety here. Okay, so let me ask you the questions. There's only 7 questions on this measure. Over the last 2 weeks, have you been bothered by the following? 0 to 3, 3 being the most bothered. Feeling nervous, anxious, or on edge. Not being able to stop or control worrying. Worrying too much about different things. Trouble relaxing. Being so restless it's hard to sit still. Becoming easily annoyed or irritable. And feeling afraid as if something awful might happen. Now keep in mind, this is a screener. It's not meant to replace an actual mental health provider. It just gives providers a sense of what it is you're dealing with, as well as giving you a sense of what you're dealing with. If you happen to have an elevated score on that, it might be time to take a look into talking to someone about what's going on in your life. Of course, there are other measures out there that take a look at different types of anxiety disorders, but that tends to be the most common one that you're going to see out in the world. So, what, or I should say how, does anxiety develop? What contributes to it? Well, there's a few different things, and in the business we call them risk factors. Typically, it's going to be some kind of interplay between genetics, like family history, biology, like brain chemistry imbalances, overactive parts of the brain, like the amygdala, as well as environmental factors, like trauma, stress, or learned behaviors. Now, I am by no means an expert on the genetic pathways that I'm talking about here as far as risk factors. So I'm just kind of going to give an overview of that. Of course, if you want to do the nitty-gritty, in-depth dive, of course, that's what the internet is for. Or you can talk to someone that you trust that might be more knowledgeable about such things. But think about this. We all have developmental pathways, right? And based on these developmental pathways, they are formed and they're shaped by our early experiences in life. So maybe this was the case for you. If it wasn't, try to put yourself in the shoes of a child who has an overprotective parent. So if you are dealing with a parent who's overly protective, oftentimes just really on top of the kid, doesn't really give them an opportunity to spread their wings and test out theories of the world, like what happens if I throw this rubber ball at the wall and don't move my head? Oh, it might bounce off and hit me back in the forehead. If you have an overprotective parent, they might not even give you that sort of ball in the first place. Anytime that you try to express yourself, they might come down on you harshly. For example, we can't say that, or we can't think that, we can't do that sort of thing. Well, what do you think the child is going to learn? Eventually, that kid is going to learn that they need to overreact to threats just like the parent does. And it's not just an overprotective parent that can lead to changes in developmental pathways. Think about an adverse event. You could think about something like maybe hearing about a fire on TV, right? Seeing a house burn down. And then maybe a child who's sensitive to such things might get really nervous and anxious around fire. And as the child develops, that's going to lead to some kind of cycle of nervousness, fear, maybe even avoidance around the thing that they're anxious about. This isn't weird or strange. It's just typical human nature. So it's not that the kid should be considered a whack job or anything. It's just that that's how they learned to develop. And now you think about how modern society can contribute to that anxiety and exacerbate that anxiety. Think about triggers that are out there. The biggest one of all, social media. I mean, social media is a great tool. I've been able to connect with people in ways that I wouldn't have before it developed. It's also a tool that can be misused. And we all like that dopamine hit, right? We all like to scroll, and we all like to see the next thing fed into our brains. The brain likes novelty, so of course we're going to keep scrolling to try to catch that next high. But what if my feed is filled with a lot of fear-based media? Maybe a lot of headlines saying, oh, violence here, violence there. Maybe it's just filled with people who are very successful. Look at all these people who are successful. Look at these programs that they might be pushing. Am I good enough? Am I able to make that threshold or to meet that threshold that they did? Can I have the good life? I don't know. Maybe I need this program because I don't really trust in myself. Think about other things as well, like work pressure or even global events. I mean, I know it's been talked to death for many years here, but I'm going to bring it up. Think about 9/11. I mean, it's been a long time, 24 years almost, since that event occurred. And yet for people like myself who were growing up during that time and saw the images on TV, I mean, they're just kind of burned into my memory banks and the memory banks of everyone that saw it. It was such a shocking event. And I remember the fear around flying. Even myself, I got kind of nervous about flying after that. And, thankfully, in my case, nobody I knew personally was affected by that event. Yet it still had some kind of impact on me. Now imagine if you lived close by to any of those events, or if you were affected by someone who lost their life in that event, or maybe suffered some kind of health issues because of that event. And so if that's an association that somebody has, well then imagine seeing something on the news about a skyscraper being unstable. Right? Or imagine if they see something on the news about, again, violence. All of this stuff is going to start to light up in the brain, and then that anxiety is going to start to get exacerbated. And again, it's not a bad thing that people have anxiety. Anxiety is a useful tool for us. So you might need to Google this because this is a podcast, so you can't really see. So you're welcome to Google this, or if you want to picture a bell curve in your mind. This is called the Yerkes-Dodson law. And essentially at the left end of this bell curve, you're going to see 0 anxiety. And at the far right, you're going to see 10 out of 10 anxiety. Of course, the bell curve being above the 5 out of 10 anxiety. And your y-axis is going to be performance. So let's go back to that idea of a test. You have a test that you need to study for tomorrow. Now I got a few scenarios here for you, so bear with me. Let's say that you have an A in this class. You have 100% in this class. All you have to do is show up, write your name on the paper, and turn it in. You don't have to answer a single question. And if you fail, you get a 0 on this test, you are still passing with a 98%. How likely is it that you're going to bust your butt trying to study for this test? Well, probably not very likely at all, because you're going to be super relaxed about it. It's no problem whatsoever. So I'm going to have anxiety at, say, a 0 or 1 out of 10. And so guess what? My performance is going to be really bad because I just don't care enough about the test. That makes sense. Now, let's go to the opposite end of this bell curve, where it's 10 out of 10. You are failing this course, and in order for you to pass, not even get a good grade, just pass, you need to get a 99 on this test. You are probably going to be freaked out. Your anxiety is going to be through the roof. This is, of course, assuming you care about your grades. But in this hypothetical, I'm saying that you do. Your body and your brain are going to go into overdrive. There's probably going to be some panic. And how you study, because you only have one night, how you study, it's probably just going to be, well, really not all that effective. Ineffective. That's the word I was looking for. And by the time you show up for the test, I'm assuming you've probably studied all night. You probably haven't even slept. Your performance on this test is probably going to be pretty poor. And that's because that anxiety in you is so high that it is just paralyzing you. Your performance is going to suffer. It's going to be bad. Just as bad as when your anxiety was at a 0 out of 10. Of course, there's different reasons for the performance suffering, but the actual outcome is that the performance is not good. Now, let's say that you have a B in this class. If you do moderately well on the test, you'll get an A. If you don't do all that well, you're still probably going to get maybe a B minus, maybe a C plus, but you'll still pass. Now, you're going to find yourself at an anxiety level of, say, a 5 out of 10. Now, think about that bell curve, and that hump on the bell curve is right over the 5, meaning that your performance is going to be optimal. Why is that the case? Because you have enough motivation that you're going to prepare as best as you can without overwhelming yourself. And when you go to sit down to take the test, you're not going to be so freaked out by it that you're just paralyzed. So in this instance, if you believe this law, this Yerkes-Dodson law, anxiety is useful. It motivates us. It helps us perform at our best. When we have too little anxiety, not so great. Our performance suffers. When we have too much anxiety, again, our performance suffers. And that's the issue with anxiety disorders. Your anxiety is sort of like a smoke alarm, right? That's too sensitive. It's going off whenever someone is exhaling, and it's not going off when it is supposed to be detecting smoke in the house. So I encourage you, take a moment and think about what some of your own triggers are. What are some things that push you to that 10 out of 10 anxiety when the anxiety is excessive? Remember, that's what we're talking about here, the excessive anxiety that's really out of proportion to what's in front of you. Because we all have them, and if you take a moment to recognize what those triggers are, you're actually going to be able to do more for yourself moving forward. I talk a lot about mindfulness and how being mindful of what's going on around us in the present moment allows us to make better decisions. And hey, shameless self-promotion, if you want to learn how to be a bit more mindful, take a look at my locals in the description. There's a 9-part seminar on mindfulness, and it helps you learn how to be a bit more present. So check that out if you're interested. And if you're not sold on that, you can just sign up for my mailing list, and you'll get parts 1 and 2 emailed to you directly for free. Now, what are some common psychological theories around anxiety? Now, keep in mind that these theories are frameworks that help explain why anxiety shows up, and the theories themselves are very diverse because, of course, the field of psychology is diverse in terms of how people view certain disorders developing or not developing. Now, if you're more of sort of a psychodynamic, psychoanalytic, Freud type person, you might view anxiety as stemming from unconscious conflicts, repressed emotions, or unresolved childhood issues. And your anxiety is going to be a signal of that inner turmoil. So maybe you believe that, maybe you don't. What are some other theories out there? Well, there's also the behavioral theory. These would be from people like Watson or Skinner. Really, anxiety is learned through conditioning of some sort, whether it's classical with pairing or operant, through reinforcement. In other words, you view anxiety or you develop anxiety because of something that happened to you repeatedly again and again and again. So let's say you are going to the cafeteria and you get your tray, and when you walk past a certain part of the cafeteria, you slip and you fall and all your food goes everywhere. And of course, everyone starts laughing at you. Well, you've learned that when you slip and fall in the cafeteria, in this particular spot of the cafeteria, maybe the cafeteria as a whole, that bad things are going to happen. So because of that learning, you then maybe don't go to that cafeteria anymore. Or maybe you go to it, but you feel this strong anxiety as you go through it. Now, if you buy into, say, cognitive theory like Beck, he mentions that anxiety develops because of distorted thinking patterns, like catastrophizing or overestimating threats. And this is going to lead to some kind of maladaptive appraisal of the situation. So I guess I just have a lot of school examples on my mind today, but imagine with this test that you go into it, you take it, and it comes back and you failed it. You go, wow, I failed this test. I'm a failure of a person. Now, that's not necessarily true, yet because of anxiety whispering its sweet nothings in your ear like a siren, well, you're going to believe that maladaptive appraisal of the situation. And of course, if you have someone like Carl Rogers, client-centered therapy, he would say that anxiety is developing because you're not allowed to be who you actually are. You have all these conditions of worth placed upon you, and because of that, you can't be the person that you want to be, because we all seek approval, right? And so I know that if I allow myself to be who I am, you may not love me, you may not care about me. So I'm going to kind of keep that in check, that part of me that really, honestly, deep down, I want to show the world. And when I do that, there's going to be a conflict, right? And so because of this conflict going on internally, that's going to lead to some kind of anxiety. And we do this all the time. I mean, think about things that you kind of wish you could say, but then you maybe think, oh, but if I say that, people might not like it. Right? Or think about if I want to do something with my life, I want to go into this particular field, and well, maybe I can't do that because people might disapprove of that. So I'm just kind of gonna go do what I want to do, or I'm gonna go do what they want me to do, and then I sort of keep the peace. But then, of course, there's all these internal conflicts going on. So these are just a few theories out there, but they highlight the point that an anxiety disorder is developing because there's something wrong, there's something off. And so while that can feel overwhelming, truth is that there are things that we can do to help ourselves feel better. So what are those psychological interventions that can help people? Well, keep in mind that everything I'm about to say is evidence-based. In other words, these ideas were developed, they were tested, there were research studies done on them, and over time, people started to say, yeah, because of the evidence we're getting, this is actually a great way to manage anxiety. Now, the research tends to show that people who just do talk therapy, about 25% of them get better. People who just take medication, about 25% of them get better. And people who have a combination of both, 50% of them are going to get better. Now, you may not want to do the medication route, and that's okay. I actually encourage people, if you can, try to do some of this stuff without the medication, because you're going to be able to show yourself that not only can you do it without the medication, so your self-esteem is going to go up, but then you don't have to take this specific pill to help you for a long period of time. Because some people just have trouble with the medication. If you're one of those people that likes the medication, by all means, you can take it. I'm certainly not saying don't ever take your medication. I'm just saying that I encourage people, see if you can do some of this stuff without using medication. You might surprise yourself and actually be able to do some of it better than you think. Okay, so as mentioned at the top, my 3 main areas of focus when I do psychotherapy: CBT, DBT, and client-centered therapy. So CBT, cognitive behavioral therapy. Really, this is conceptualized as trying to find what thoughts and behaviors maintain anxiety. And these thoughts and behaviors are considered, in my script here, it's written as faulty. I wouldn't say it's faulty, but inaccurate, I think, is a better word. Inaccurate thoughts and maybe ineffective behaviors. So what are you going to learn to do if you are working with someone who's more of a CBT purist? Well, first off, you're going to learn all about cognitive restructuring. Right? So your therapist is going to help you identify some of the negative beliefs that you have, some of the negative assumptions that you have that you might not even realize that you have, because they've become so second nature to you that it's just habit. And once you find out what those thoughts are, then you can start to challenge them a bit. Well, is it true that this is the most accurate thought for this situation? If it is, great. You keep thinking it and you keep living your life based on that thought. If it's not, well, then maybe there's some tweaking that we can do. There's also going to be a little bit of what's called exposure therapy. So this is where you gradually start to face your fears. So what is exposure therapy all about? Well, the idea is that the more that you do something, over time, the less anxiety you start to feel. And we know this intuitively. So think back, if you're old enough to be driving, think back to the first time you got behind the wheel of a car. How anxious were you? Well, you can't tell me, but I imagine you were pretty anxious. I know for myself, I was quite anxious, because I'm getting in the driver's side, and I got to figure out where the steering wheel needs to go, the height of it, right where my hands go, the mirrors. I got to figure out where the seat is supposed to be so it feels comfortable. I got to adjust everything. There's a lot to keep in mind. So of course, anxiety's high. Now when I get behind the wheel of a car, after having done it for decades, well, it's no problem. I just get in, I adjust my stuff, and I go. And I imagine the same is true for you. So through exposure therapy, we begin to expose ourselves to situations that are causing us anxiety. And over time, we start to habituate to them. That's your $10 psychology word. In other words, we get used to them. So as an example of what this could look like, imagine that you have a fear of snakes. And maybe you do have a fear of snakes, I don't know. We could lock you in a room full of snakes for a while, like Indiana Jones, and eventually you're going to feel calmer. I'm not saying you're going to feel calm, but eventually the body, the nervous system, is going to need to release. Now, that probably sounds not appealing in the slightest to you, and it doesn't sound very appealing to me either. So instead, we can do a technique where we gradually work our way up to conquering the fear. So we rank order some things, maybe low anxiety up to high anxiety. So maybe talking about snakes, right? We just kind of keep doing that until you start to feel okay about it. And then maybe we start to look at pictures of snakes. And we just keep doing that until your anxiety comes down. And then maybe it's videos of snakes. Right? And then maybe it's going to the zoo and seeing snakes, behind glass. Right? Maybe it's then going into a room with a snake in glass on the other side. And then maybe you start to move up closer to the snake. Then maybe you're in a room where the snake is out of the cage, but they're far away. And then you start to move up slowly, and eventually you get to the point where maybe you're petting the snake, you're holding the snake. And you do all of this with the explicit goal of reducing your fear and your anxiety around a specific, thing that you're afraid of. I use the example of snakes, but it could be used for other things too. I mean, maybe you're afraid of open areas. Maybe you're afraid of presenting in front of people. You can also run things like behavioral experiments. So a classic one, I've heard it called different things over my career, but the name that really sticks for me is the intentional mistake. So as an example, you're going to do something intentionally wrong, quote unquote wrong, and then go live your life. So a common example of this is if you have a button-down shirt, say, you're going to button the wrong button into the wrong hole. So your shirt's going to look a little goofy just at one part. And then you're going to go live your life. Or maybe you put your shirt on inside out. Or maybe you wear two different types of shoes. Whatever the case may be, you're going to go out there and you're kind of going to expose yourself to that worst case scenario. And that worst case scenario is often far less than what we tend to think about in our minds, right? If I think about, okay, well, I'm going to go to work and I'm going to have a button mismatched. If I'm suffering from an anxiety disorder, I might think, oh my God, everyone's going to laugh at me. Everyone's going to say I look stupid. Everyone's going to comment on what a moron I am. When in reality, what's actually going to happen? Well, people might look at you. Someone might say, hey, it looks like your shirt's a little messed up. But most likely what's going to happen is nobody's going to notice because everyone's in their own worlds. And this is going to help the client learn that maybe the thoughts they're having, the behaviors they are avoiding or engaging in, if it's avoidance, maybe that's not all that useful. Now, from a dialectical behavior therapy standpoint, Linehan, who developed DBT, views anxiety really as stemming from intense, unregulated emotions and invalidating environments. In other words, maybe your feelings weren't talked about, weren't valued, weren't acknowledged or validated. And so, of course, you're not going to start to express yourself, right? You're going to keep those emotions inside. Maybe you're going to start to feel anxious. Maybe the anxiety comes out as more externalizing behaviors, right? This tends to happen with boys where they will start to kind of get into things or destroy stuff or run around or because they have this anxiety, they just don't know what to do with it. That's typically what happens. Of course, boys can feel that anxiety internally as well. And usually the typical for girls is that they do internalize their feelings and just kind of think about the stuff and worry again and again and again. Now, DBT is going to integrate, shocker, mindfulness. It's going to help you stay present in the moment. It's going to teach you skills to help you when your anxiety's in that 8 to 10 range to cope with crises without avoiding them. It's going to teach you how to regulate your emotions when you're in that 0 to 7 range. How to identify what I'm feeling and how do I regulate those feelings, as well as interpersonal effectiveness skills. You can think about this as communication training or assertive communication. All of these skills come into play and they help somebody bring their anxiety down. I really love the DBT skills because I think they're very helpful and very practical. They take practice. However, I think that they are really wonderful. And lastly, looking at client-centered therapy, Rogers would conceptualize anxiety as resulting from incongruence between one's self-concept, how you view yourself, and your experiences. So how I go through my life is not lining up with how I view myself. And this is often due to conditional acceptance from others. You only like me if I present a certain way or if I act a certain way. Now, here's the thing. That might be real or it might be perceived. Regardless, the therapist is going to provide empathy, unconditional positive regard, and genuineness and congruence to create a safe space for self-exploration and growth. And this is going to help clients achieve the self-actualization that they're looking for and reduce inner conflict. Now, the nice thing about client-centered therapy is that it is very non-directive and relationship-based. Not that other therapies aren't, but in this case, client-centered therapy really views you as the expert on you. I'm not the expert on you. If you were my client, I'm not the expert on you because I haven't walked a single second in your shoes. You're the expert on you. I'm the expert on psychology. And so when we meet, we really kind of dig into your thoughts and your emotions and what's going on in your life. And ask questions about what's going on, and we kind of talk about, well, what path forward helps you reach your self-actualization and reduce that inner conflict. And it might sound really basic, but I'll put it to you this way. When was the last time that you had somebody in your life give you a full hour of their time and focus just on you? And really try to dig down and understand exactly where you're coming from, what your life experience is. My guess is that it's been a long time, or it's rare, or it's probably never happened at all for you outside of a therapy office. And even then, there are a lot of different therapists who are very direct. Well, you need to do X, Y, Z. I remember interviewing, for instance, at a very prominent academic research center when I was in my doctoral program in Chicago. And this particular place talked about you need to know the manual front to back. And when people come in, you need to give them the worksheets and you need to follow the script and you need to just give it to them just like the manual says. Now listen, I'm not against manualized treatments. I think there's a lot of great ones out there. The problem becomes when all we're doing is focusing on the manual, and the manual is the way that people heal. Not necessarily. In fact, the most important part of any therapy is that relationship, the therapeutic alliance. Right? You need to feel comfortable with your therapist. And if we're talking about working through anxiety, man, going to a therapist who is empathetic and non-judgmental and is really trying to understand you, that is so much more valuable than what the manual says next. Again, the manual is important. It's just not the be-all, end-all. So I tend to blend all three of these treatments when I meet with people, and I will use them, as I mentioned, when treating anxiety specifically. Now, let's say you're not interested in doing therapy with me, which you should change your mind. No, I'm just joking. But let's say that you're not interested in doing therapy with me. Maybe you already have a therapist, or maybe you're just not interested in therapy at this time. No problem. What are some things that you might be able to do to help yourself manage your anxiety? And by the way, if you are in therapy right now, these things can still help you. So I think these are useful for anyone at any stage of seeking therapy. First off, the best thing that I can encourage is breathing. And I know that sounds a little strange, but we always have our breath with us. It is cheap as free. So I encourage you, take some time and do some belly breathing, some diaphragmatic breathing. Right? Notice how you tend to breathe. Usually people with anxiety, they tend to breathe a lot into their chest. It's shorter, shallower breaths. But when we're relaxed, we're going to be breathing into our belly. Because when we breathe into our belly, that activates our rest and digest system. And if we breathe into our chest, it's going to activate our fight or flight. And think about this when you do something physically strenuous, right? You're typically breathing into your chest, right? You're getting the body amped up and ready to go. If you are trying to breathe into your chest to calm down, you're just fighting yourself. Because at the end of the day, the body's trying to amp up, but you're trying to calm down. It doesn't really work all that well. So I encourage people, take some time and breathe into your belly. And if you're unsure if you're doing this right, you can put your hand on your stomach. And I encourage you to do this right now if you're unsure if you're doing diaphragmatic breathing correctly. And when you breathe in, pull the air down into your belly, your hand should move up with your belly. It should rise up with your belly because you're filling your belly with air. And when you exhale, your hand should sink back down towards your body, just like your belly is doing. So you can use your hand as a guide to see if you're breathing in deeply, into your belly, that is. Now, the other thing to keep in mind is that you want that smooth inhale and that smooth exhale. A lot of times I'll work with people and it'll be something a little off, right? It'll be like a quick inhale. Or it'll be the opposite. It'll be nice big deep breath in. Well, that's not what we're going for here, right? We're going for retraining our breathing so that we can rely on it when that anxiety starts to spike. And I'm going to encourage you all, if you have a minute, don't do this if you're, driving or something. But if you have a minute and you're in a safe place, I encourage you to close your eyes. And if you can't close your eyes, say maybe you're listening to this and you're walking, that's okay. You can still do the actual breathing exercise. Just be aware of your surroundings. And take a nice big deep breath into your belly. And exhale. And I'm going to do two more with you. Take another nice big deep breath in. And exhale. And once more, take another nice big deep breath in. And exhale. And this is where I would ask you, check in with yourself. How does your body feel right now? How does your mind feel? How are your emotions? Almost always, I will hear people say, I feel calmer. I feel a little bit better. Some people might say, I actually have a little bit of a headache. And that's probably because they're not used to taking in so much oxygen. They're just so used to breathing from their chest that it's almost kind of overwhelming. That's okay. The more that you do the deep breathing, the easier it starts to get. Now, if you are looking for some help around breathing, particularly maybe you want to follow along with somebody, well, all you have to do is scan this podcast. In fact, I'll put the link down below. It was just a few weeks ago, I released a mindfulness exercise that does include some breathing. And I know I've had a variety of breathing exercises in the many-year history of this show. God, it's going to be 9 years this year. That's crazy. Thank you all for your continued support. Now, I'm not endorsing any of these. Well, I shouldn't say it like that. I am not sponsored by. That's what I'm trying to say. I'm not sponsored by either of the next few things. that I'm going to mention, but these are just tools that I like personally and I think are helpful. If you have iOS, you can take a look at the Breathing app, which I think is beautiful. It's a wonderful app. It's free. It's got a little ball on there that expands and contracts, and you breathe along with it. It plays a tone, to help you out. As well as I really like the VA Mindfulness app. I believe it's called Mindfulness Coach, and that's completely free as well. So check that out. See if you like it. I'm sure on Android there are other breathing apps that probably have a ball that expands and contracts in the same way, but I don't have Android, so sorry about that. You'll have to find that one on your own. The Mindfulness Coach, though, is on both iOS and Android. Something else that you can do to help yourself out is, again, journal your triggers. Get a sense of what it is that sends that anxiety up for you. And the more that you're aware of those triggers, the more that you can make more informed decisions. And finally, kind of going along with that is trying basic mindfulness. Experience the present moment as it is, without judgment, without getting upset with yourself. If you find that you're feeling anxious, just sit with it. What does that feel like? Where is that in your body? Take note of how it changes as you go through the next minute or two. Because here's the thing, anxiety is very similar to a wave, right? It can come up and it can feel like it's intense, it'll never go away, but eventually that wave is going to crash down and fall back into the ocean, right? And when that happens, okay, got your relief. And sometimes you just have to ride the wave out, because there are things out there that are going to cause us anxiety, and that's sometimes a good thing if you're to believe the Yerkes-Dodson law, which I do. I'm a huge proponent of that. So just keep this in mind, that anxiety does not have to run your life. So, over the course of this podcast, we talked a bit about what anxiety is, how it develops, some key psychological theories about anxiety, as well as some key treatments. Now, if you are someone who still isn't quite sure if you can handle this on your own, I do encourage you, seek out a professional and try to get some help from said professional. If you've tried working through it maybe with friends or family, just hasn't quite worked out, support groups, seek out a professional. And if you like what you hear today, you want to work with me, then check out royaloasispi.com and take a look at my website, see if it's up your alley, and if it is, send me that contact form, and hey, I look forward to working with you just as soon as I can. But that's going to conclude our episode for today. I hope you found this helpful, and I've been enjoying doing this series on various mental health topics, so I would love to hear from you. If there's a topic you'd like me to cover, please do reach out to me on Twitter, Dr. GT Obert. I would love to hear from you in general, but also, if you have a topic you'd like me to explore, I'd be more than happy to at least take a look at your suggestion, and if I think it fits, I'd be more than happy to do an episode on it. So thank you all so much for listening. Be sure to like, comment, subscribe, do all that fun stuff here. I say that like it's my script for my YouTube channel. I do have all of these episodes up on YouTube. Dr. Gregory T. Obert, you can find me there. So if you're watching on YouTube, please like, comment, and subscribe. If you're watching or listening somewhere else, please do leave a 5-star rating and review. And thank you so much for your continued support. Until next time, be safe, be well, be powerful.